There are menopause symptoms that women talk about more openly now. Hot flashes, night sweats, brain fog, weight changes, mood swings, broken sleep. And then there are the symptoms many women keep hidden. Dryness, burning, irritation, discomfort during intimacy, a sudden need to rush to the bathroom, waking up at night to urinate, feeling as if urinary infections are becoming more frequent, avoiding closeness because the body no longer feels comfortable, feeling embarrassed, confused, or even ashamed. If this is your experience, this video is for you. Today we are talking about vaginal dryness and urinary urgency after menopause. Two areas of women's health that deserve much more honest, respectful conversation. Welcome to the Herbal Bloom. Here we discuss menopause education, natural wellness, healthy aging, and practical support for women over 50 without shame and without miracle claims. Let's start with the most important message. Intimate discomfort after menopause is not a personal failure. It is not a sign that you are dirty, broken, unattractive, or simply getting old in a way you must silently accept. It is a body signal, and body signals deserve attention. During menopause, estrogen levels decline. Estrogen does many things in the body, and one of those things is helping maintain the health, elasticity, moisture, and blood flow of tissues in the vulva, vagina, urethra, and bladder area. When estrogen is lower, those tissues may become thinner, drier, more sensitive, and more easily irritated. For some women, this feels like dryness. For others, it feels like itching, burning, tightness, or discomfort with clothing. Some women notice pain during sex, or soreness afterward. Some notice light spotting after intimacy. Others feel urinary urgency, the sudden message from the bladder that says, "Go now." Some wake several times at night to urinate. Some feel they are getting urinary infections more often, or they have urinary symptoms, even when the situation is not straightforward. These changes can affect daily life in ways people underestimate. A woman may stop taking long walks because she is worried there will not be a bathroom nearby. She may avoid travel. She may sleep poorly because she is waking to urinate. She may feel anxious in meetings, in the car, or at social events. She may avoid intimacy, not because she lacks affection, but because her body has started associating closeness with pain. And because the topic feels private, she may say nothing. That silence can be heavy. Many women think this is just part of aging. Some think, I should be able to handle it. Others worry they will be dismissed if they bring it up. But symptoms that affect comfort, sleep, movement, confidence, and relationships are worth discussing. Common does not mean irrelevant. Common does not mean untreatable. Common does not mean you have to endure it. Now let's talk about what you can observe. First, notice when the symptoms appear. Is dryness constant or mostly during intimacy? Is burning worse after using soap, fragrance, wipes, pads, tight clothing, or certain laundry detergents? Does urinary urgency happen after coffee, alcohol, carbonated drinks, spicy foods, or a stressful day? Do symptoms worsen when you are dehydrated? Do they appear with pain, fever, blood, or unusual discharge? This is not about becoming obsessed. It is about creating a clear picture. A simple symptom diary for 1 or 2 weeks can help you speak more clearly with a clinician. Instead of saying, something feels wrong, you can say, I wake twice a night to urinate. Or, I feel burning after using scented wipes. Or, sex has become painful over the last 6 months. Or, I have had repeated urinary symptoms this year. Specific information can lead to better support. Second, consider gentle hygiene. Many women respond to intimate discomfort by cleaning more aggressively. They use fragranced washes, deodorizing products, wipes, sprays, strong soaps, or repeated washing because they fear odor or irritation. But the vulvar and vaginal area is delicate. Harsh products can make dryness and burning worse. A gentler approach often means avoiding fragrance, avoiding internal cleansing products unless prescribed, using mild external cleansing only, wearing breathable underwear, changing out of sweaty clothes, and noticing whether pads, liners, detergents, or tight fabrics are irritating the skin. More cleaning is not always more care. Sometimes care is removing what irritates. Third, understand the difference between lubricants and moisturizers. A lubricant is usually used during sexual activity to reduce friction and discomfort. A vaginal moisturizer is used regularly, not only during intimacy, to help with ongoing dryness. These are not the same thing, and many women do not know the difference because no one has explained it to them. Choosing a product can be personal. Some women are sensitive to fragrance, warming ingredients, certain preservatives, or high osmolality products. If irritation happens after using something, that is useful information. A pharmacist, gynecologist, or qualified clinician can help guide safer choices, especially if symptoms are significant. And then there are medical treatment options. This is important. Natural support and medical care do not have to be enemies. You can use gentle routines and still ask a clinician about evidence-based treatment. For some women, local therapies or other medical approaches may be appropriate. For others, different causes need to be ruled out first. The right path depends on personal history, symptoms, cancer history, medications, bleeding, infection risk, and medical evaluation. The point is not to self-diagnose. The point is to stop suffering silently. Now let's talk about urinary urgency. The bladder is not separate from the menopause story. The tissues around the urethra and bladder can also be influenced by hormonal changes, aging, pelvic floor function, fluid habits, and irritation. Some women begin to feel urgency, frequency, leaking, or nighttime urination. Others notice that caffeine suddenly affects them more than it used to. A practical first step is to observe bladder patterns. How much coffee do you drink? Do you drink very little water during the day and then a lot at night? Do you rush to the bathroom just in case many times a day? Do you leak when coughing, laughing, or exercising? Do you have burning when urinating? Pelvic pain, fever, or blood in the urine? Those details matter. Pelvic floor health may also play a role, but here is a common misunderstanding. Pelvic floor support does not always mean doing endless Kegels. Some women have weak pelvic floor muscles. Others have muscles that are tense, guarded, or poorly coordinated. Doing the wrong exercise for the wrong pattern can be frustrating. This is why pelvic floor physiotherapy can be so helpful. A trained professional can assess what is actually happening and guide relaxation, strengthening, breathing, bladder habits, posture, and movement. It is not about embarrassment. It is healthcare. Let's also talk about intimacy, because this is where many women carry private grief. Pain with sex can change how a woman feels about herself. She may worry that her partner will feel rejected. She may force herself through discomfort. She may avoid touch altogether. She may feel sadness because a part of life that once felt natural now feels complicated. If this is you, please hear this clearly. Pain is not something you have to prove you can tolerate. Intimacy should not require you to disappear from your own body. Communication matters. A gentle conversation with a partner can change the emotional pressure. You might say, "My body is changing, and I want closeness, but I need us to slow down and find what is comfortable." You might explain that dryness or pain is a physical symptom, not a lack of love. You might decide together to seek help, use lubricant, explore non-painful forms of closeness, or pause penetration while the body receives care. Your comfort matters. There are also red flags that should not be ignored. Bleeding after menopause should be evaluated. Persistent pelvic pain should be evaluated. Burning with urination, fever, back pain, blood in the urine, or repeated suspected infections should be discussed with a clinician. New or severe symptoms deserve medical attention. Pain during sex that persists also deserves evaluation. The goal is not to panic. The goal is to be responsible with your body. So what can you do this week? Start with one quiet inventory. Write down what you are experiencing without judgment. Dryness, burning, itching, pain, urgency, frequency, nighttime urination, leaking, triggers, products used, intimacy discomfort, duration, anything that worries you. Then simplify irritants. Choose fragrance-free external care. Avoid harsh wipes and sprays. Notice laundry products. Wear breathable fabrics. Hydrate steadily earlier in the day. Reduce bladder irritants if you suspect a connection, such as too much caffeine or alcohol. Consider whether a lubricant or moisturizer conversation is needed. And if symptoms are affecting your life, make an appointment with a qualified professional. You can simply say, I am having vaginal dryness and urinary urgency after menopause, and I want to discuss options. You do not need perfect language. You just need to begin. A good clinician has heard these symptoms before. You are not shocking them. You are not being dramatic. You are describing health concerns. This is the part one I want you to remember. Silence is not a treatment plan. Many women have spent decades caring for other people's discomfort while minimizing their own. They make the appointments, they remember the medications, they pack the bags, organize the meals, manage the emotions, and keep life moving. But when their own body whispers, they ignore it. When it speaks louder, they apologize for it. No more. Your comfort is worth attention. Your sleep is worth attention. Your intimate life is worth attention. Your bladder health is worth attention. Your dignity is worth attention. Menopause is not only about ending periods. It is a whole body transition, and intimate tissues are part of that body. There is nothing shameful about needing support. So today, replace embarrassment with information. Replace silence with one clear sentence. Replace self-blame with curiosity. Replace, I guess this is just aging, with I deserve to understand what is happening. You do not have to talk about it with everyone, but please talk about it with someone qualified. If this video helped you feel less alone, subscribe to the Herbal Bloom for more menopause education, natural wellness, healthy aging, and practical women's health guidance for life after 50. And remember, you are not broken, you are not dirty, you are not alone. Your body is asking for care, and you are allowed to answer.